I'm Dr. Katie. I'm both a medical doctor and a breast cancer survivor. And today I'm going to talk a bit about the hormonal therapy I'm on. So I belong to a number of groups for breast cancer patients or breast cancer survivors. They're generally just women who are giving each other advice as they learn to cope with their breast cancer treatments. And one of the things that I've seen is a common thing that's posted is people asking, are you on, this particular hormonal therapy? Are you having this side effect? And there tend to be a lot of questions. I've seen a lot of questions about tamoxifen. I've seen a lot of questions about Femera, and people just kind of ask, are you tolerating your hormonal therapy? I don't want to be on hormonal therapy. Should I go against what my doctor's saying and stop my hormonal therapy because of, side effects or because of concerns about it? And it surprised me. I've been on hormonal therapy for a number of years. So I started my hormonal therapy, it would have been when I started chemo, December of 2017. I initially was on tamoxifen, and then after chemo finished, I switched to something called Zoladex, so that it's an injection. I get a pellet injection into the fat in my stomach every month that keeps me in menopause, and then it allows me to take Femera. And so I've been on that since the beginning of 2018. And yeah, that's my life. And there was a time when the combination of hormonal therapy and chemo, or hormonal therapy and radiation, was really difficult. And I essentially counted down the time till I went off hormonal therapy, which keeps just getting pushed back and back and back, because I'm really lucky that I have had a cancer that is really responsive to hormonal therapy. So what sort of side effects have I experienced is a question I get. And do I recommend the hormonal therapy that I've been on to other people? I'll address that second question first. Every person is different. Everybody's cancer is slightly different. Everybody's side effects profile or the things that sometimes they experience because of medication is different. With the advances of cancer care, they're really able to tailor much more personalized treatment. So I really recommend you get advice directly from the oncologist that is looking after you. For me, it's been life-saving treatment. I was diagnosed with locally advanced disease, as in I had a very large tumor. I had disease in my nodes. I am doing everything I can possibly do to give myself my best chance of being disease-free. And sorry, I was glancing at my dogs. I'm grateful. I think that for hormonal therapy, I think that it's played a major role in me being able to be well and not have cancer recurrence. So yeah, for the most part, it's been a really positive thing, as I am cancer free, and it's been almost 3 years since diagnosis, and this is just phenomenal. And one of the things that's been really hard for me to stomach on a lot of the cancer forums is seeing women that are around my age at diagnosis, late 20s, early 30s. I was diagnosed about 34. A lot of the women I remember corresponding with initially, or watching and commenting and seeing their posts, a lot of the young women have passed away for whatever reason. And part of it is because when you're younger, It's more common to have more aggressive forms of cancer, breast cancer, and you're more likely to be diagnosed with more advanced disease. I certainly was. And it's just, there's poor outcomes. A lot of these women who have passed didn't have hormonally positive breast cancer. They didn't have the option of being on hormonal therapy. So I guess for me, I view the option of hormonal therapy as a huge blessing, and is part of why I am alive right now. And a lot of the women I knew when I was initially diagnosed have unfortunately passed. Most of those women were not. They didn't have estrogen and progesterone positive breast cancer. So that's sort of my experience. If someone asks me if you're given the option of hormonal therapy, would you do it or not? That's obviously a deeply personal decision, but for me, the answer is yes. I'm gonna do everything that I can to fight for my life. I'm not ready to die. I have a lot more that I want to contribute to the world to help it improve it in some shape or form.